genetically, if your parents have diabetes, you have a high chance of getting diabetes. Any genetically transferable disease which is there, it might be blood pressure. If your parents are having blood pressure or high level sugar, some organ problem is there, it can transfer to you. Within that three, you have to check that either your parents are having like that. If your parents are fat, you will also become to the same fatness at that age. Both the parents you take, in an average you will get the height and the weight, how much you gain at their age, you will be getting their same weight. So these are all genetics. If there is any disease genetically there, it is a factor for a health problem. First you should check that. You inquire your parents, are you having any chronic disease? What do you mean by chronic disease? Long lasting. Any long lasting problem is there for them, you ask them and you be aware. You ask your grandparents, they know very well, and you be aware of that. That is called the factors that can influence your health. Next thing is lifestyle choice. Certain people will be having a choice of doing exercise. The same benefit you will get. It increases your health. Somebody will be having a smoking behavior. Even early smoking, those people, due to their behavior, their health will get affected. Next thing is environment. Certain places in the earth have certain types of disease. If you are located in a deserted area, you will be having headaches. Central headaches will be very high because of dehydration. Frequently, according to the location, according to the environment. Imagine you are living in Delhi. What kind of problem you might have? Respiratory, that is lung problem you will get. Why? Because the Delhi is being polluted. The environment is polluted. Imagine if you are staying in a place where there is no drinkable water is there. Purified drinkable water, you have only river water or well water. Are you having a chance of getting communicable disease? Communicable is spreadable. If you are not having a good drinking water, what disease you might have? Typhoid, dysentery, these things will come due to non-proper supply of the water. So according to your environment, where you stay or where you are living, according to that, certain types of disease might come. If you are living there, make sure that you wear mask. This is a factor, health factor. If you are living in Delhi, what you have to do? You have to take any mask. So this will help you. Next thing is social economic status. That means if you are wealthy, you will be taking care of your health issues easily. If you are poor, can a poor person have health treatment as like as a rich person? Not possible. So they will be having a social economic status. If your economy is down, you will be not having a higher health facility or better health facility. Next thing is education. Those who are educated, what they will do is immediately if any health problem is there, they will go to the specialist. Those who are not having health issues, you take an example of your grandparents. If any disease comes, they will not go to a doctor. Why? Because going to a doctor, they will make us to sit in hospital, so we cannot come back to home. That is their thinking. Do you have any grandparents like that? Whatever issue might be there, they will not go. The thing is, they don't have education. That means they think that if they go to hospital, they will be hospitalized, so that they will take some decision. So not having a proper education, if you are educated, you will go to the right axis, or else will you take insurance? Those who are educated will take insurance. For that you need some education. Yes. Next thing is healthcare access. If any place is not having healthcare access, you will be ending up in illness, injuries or disease. This is an example. This statistics I have taken from India. How many primary healthcare are required? In 2023, this statistics I have taken, how many primary healthcare are required according to norms is around 27,661. Currently, there is a 23,236 primary healthcares are only there. And you check the other one, community healthcare, nearly half of them is lacking. Due to healthcare access, if you are not having access, what will happen? If you get some disease or some health problem, you don't have the facility, it ends up in health issues. This is the example of health access. Next thing is mental health. Depressed, anxiety, stress affected people. See, I have some statistics for you. This is the statistics I got from PS Code. This statistic shows that in India we have a lack of stress handling facility. Psychiatrist, have you seen? Psychiatrists, psychologists, nurses and social workers per 1 lakh people. This is the statistics. Can you see this? For 1 lakh of population, how much of psychiatrists are required? One psychiatrist. Can you see here? This is according to mental disorders in India. There is a shortage of workforce. That means for 1 lakh of population, you need one psychiatrist or one nurse, etc. But actually, how much are available now? 0.3. That means for 3 lakh of people, we have one psychiatrist. We have some hospital and psychologists, social workers, etc. So this is a lagging. So due to that, they have this kind of statistics. How many mental illness percentage of people are there? Male are much higher, 13.9 mental illness, and female are 7.5 percentage of mental illness in the population. Next thing is social connections. Last one is behavioral factor. Behavioral factor is, which I have told, risky behaviors. You might be driving in a car without wearing a seat belt. It is a behavior, no? So next thing is advice, substance, etc. And last one is cultural factor. So